Maternal mortality can be defined as any sort of death relating to pregnancy complications before or after giving birth. Over 90% of these deaths occur in developing countries, most of which are caused from severe hemorrhaging, infection, AIDS, HIV, malaria, and unsafe abortions. The maternal mortality rate shows the number of deaths for every 100,000 pregnancies. This number ultimately reveals the quality of a country's healthcare system. The predominant factor to the high mortality rates in developing countries is simple: lack of prenatal care. During the 20th century, maternal deaths in the U.S. decreased significantly due to newly developed procedures and tactics. In the U.S., when a woman becomes pregnant, receiving prenatal care is always a top priority. Even if the pregnancy is unplanned, women are able to receive classes from clinics or hospitals that brief them on what they are about to experience. These classes range from being monthly to even weekly. While in labor, women also have the ability to receive drugs or surgeries that deteriorate the excruciating pain.
What should an individual do to prepare for childbirth?
I think definitely taking classes is important. I think that both the mom and dad need to be familiar with the process and what's going to happen so that they're not afraid, because I think fear plays a big part in not making it go smoothly. So I think they need to be very prepared and prepared for what life with a newborn will be. I think every mom-to-be definitely needs an idea of what will make for a healthy baby. So I think they definitely need nutrition. I think they do need to know about the childbirth process. I think they need to know good nutrition, I should have said, for both mom and for a newborn baby or a baby after birth. I think they need to know normal growth and development, and I think they need to know preventative measures, against problems with their pregnancy. For example, no drug use, no alcohol, and all the things that are recommended testing.
Now, a lot of people use pain medications during childbirth. What are the risks to using those?
Pain medications that are like narcotics, they depress the baby. So if the baby is born too soon after having those, they don't necessarily breathe right away. They might need assistance breathing. They're a little pokey. They may not nurse as well or feed as well right away. An epidural, usually it's not quite a depressing effect on the baby and their breathing responses and things. I think it has been proven statistically that they don't necessarily nurse as fast. So there's always a risk-benefit to giving medications. On the other hand, if the mom really needs them, the timing is very important to try and make sure it's not still on board when the baby's born.
What do you mean by the timing? It's important.
To have it far enough before the delivery so that it has a little bit of time to wear off before the baby is born. Otherwise, they do have a drug called Narcan that they give the baby, and that takes the effects of the narcotic right away.
What are common symptoms that women might endure after childbirth?
Common symptoms, as far as pain, they might have pain. If they had a vaginal delivery, they'd have pain, episiotomy pain possibly, or pain in that area, or else C-section, they'd have incision pain in their abdomen. So that would probably be it. What other, did you say complications or symptoms?
Symptoms or complications.
Because they can always bleed, and that's a complication. That would be a hemorrhage. That can happen, in the first couple of days after childbirth. What other things? There's always symptoms of breastfeeding. The breast can hurt, and things as they're initiating the breastfeeding. Other complications can include a lot of women get gallbladder problems after pregnancy and childbirth, and so you have to watch for that. And you have to watch for postpartum depression, those kinds of things.
Okay. What can women do in order to fully recover from childbirth efficiently?
Well, I think one of the things that they're talking about in all the childbirth classes now are exercises to prepare, which also help you to get back into shape faster and to help you with the symptoms. So I think those kinds of things, I do not know what those exercises are exactly, so I can't tell you precisely. I just know that they're out there and being taught at the moment. As I said, I think you were saying prepared to get back, to get back into shape after, was that?
Yes, recover from childbirth.
Recover from it. I think a lot of it is just knowing, again, being prepared to know what's coming, so that if you're not afraid, you'll recover faster. That's going to happen.
All right. Thank you again for your time.
Even if a young teenage girl manages to get pregnant, it is possible for her and her baby to remain safe as long as she receives proper prenatal care. Prenatal care can be something as simple as breathing exercises or planning out the route to take to the hospital. Either way, it is absolutely imperative that a pregnant woman receives this type of care in order to secure the well-being of herself and her future child.